There is a disease condition in Ayurveda which is termed as prameha. It is a group of metabolic disorders. Many people do compare certain aspects of prameha to the concept of diabetes. It is not a simple problem for sure, and when we talk about the causes of this disease, it is pretty interesting to see that the imbalances which are generated can also be very different. So let's first talk about what could be the causes or the causative agents which result in prameha, a disease condition. In this disease condition, one of the primary causes are considered to be a sedentary lifestyle, where it is termed as Asya Sukham, where a person is constantly sitting for an extended period of time, Swapna Sukham, where they tend to have a lot more of sleep or a kind of a tired lifestyle, as such not really moving very much. Then they talk about food triggers in the sense that they tend to have extremely heavy foods which are dominant in milk and milk products, which tend to increase the kapha dosha. And they also talk about things such which are made with a lot of jaggery, and in general things which tend to increase the kapha dosha. So the inherent properties which tend to do that would be something which is extremely oily, something which is primarily braised in milk and milk products, and also something which tends to contain a lot of sweet taste associated with it. Now that we have understood the causes of this disease condition, the presentation can vary a lot. It is not the same, and the inherent properties and the qualities of the doshas involved can vary. And that's why they classify prameha, the disease condition, into 20 subtypes based on the dominances of vata, pitta as well as kapha. And I think many of us do see that the presentation in each individual does vary. Primarily, this disease condition is considered to be a problem associated with the urinary system. Prameha, if we see the term, meha means urine and pra means excessive. So there is an excessive production as well as an elimination of the urine from the body, which is indicating the changed metabolism. And based on the changed nature of the urine, they have subdivided it into 20 types. Now among these, the most common one which we can correlate to diabetes is one which is called madhumeha, which comes under an imbalance of the vata along with the kapha dosha, making it more difficult to treat or completely cure. In this case, the madhu, as they mentioned, means honey. So it indicates that the nature of the urine becomes similar to that of honey. So obviously that indicates that it becomes sweet, and it could also be a little more viscous or turbid in nature, similar to the aspects which we see in a person who has diabetes. So for this particular condition, the approach would be to definitely improve the Agni or the digestive prowess which is hampered or affected in them, and also change the nature of foods based on the fact that they are not going to increase the kapha dosha, because as we saw, primarily in this disease condition there is an imbalance of kapha. But based on the individual, this would vary again. In case they have associations of characteristics which indicate that pitta dosha is involved, it could present as burning sensation of the hands and feet, excessive sweating, just a feeling of general burning sensation within the gut and so on. Or it could present as a excessive weight loss, which could indicate the dominance of vata. So based on these permutations and combinations, the approach as well as the treatment would have to vary.